Well, greetings again. This is Dr. Bill Wyatt, and we are back down to some normal orthodontics, and we'll talk about that. And we're talking about restorative dentistry, and using orthodontics is a way to get to do the restorative dentistry. So let's get on this case. I'll try. This is a normal case, and it's not a big deal. Here's this young man, nice looking face, no problems at all in that respect. But when we look at his teeth, he's got a Class 2 Division 2 case where the upper front teeth are tilted way back in like this, and why they grow that way, and the bite is closed. You don't even see his bottom teeth right here. I think one thing we ought to let kids gnaw bones or something like that and keep their teeth from going down and closing over one another like that. Then later, young men frequently will grow, the bottom arch will grow out further as they get older. And then if your teeth are locked in like this, the jaw grows and moves, and it pushes the condyle back into the retrodiscal tissue, and that's where you come in some problems with this type of case. And if you didn't know orthodontics, you could take these teeth and line them up like that and open this out. So let's watch this happen in this case. This is in 1990, 3/26 of 90, and everything's fitting. He's got a Class 2 Division 2 case, and these teeth are back 1/4 of an inch behind this right here. And the lower teeth are closing up here. You didn't even see the lower teeth. So we're going to raise these teeth up, and when we do, we spread this out. The lower jaw will just come forward. Many of the cases, you may have to pull them a little bit to get them out there, but not much. In other words, you're restoring this mouth. You're not putting teeth back in here, but you're restoring it to what it ought to be to start with. So that's restorative through orthodontics. You're not adding teeth to it, but you're restoring the mouth. You're fixing it like it's better. Here it is, it's 4/24 of 90, and this is in a Class 2 situation. This molar tooth ought to be out. It should be somewhere like this. In other words, it's about that far off, and that's about that far off out in the front of this. Now to bring this jaw forward, we have to move these teeth out of the way, open it up right here, and we don't want to open this bite too much in this area. We've got a cross bite here, right there, and all this stuff will go fast. You can go do this, something like this, 4/24 of 90. Now let's look at the other side. We put one of these large arches, or this is a intruding arch. Now it went down like this. We raise it up and hook it over the teeth. It pushes the molars up and it brings this down. And you can wear a pad if you don't want to increase the vertical height of the face. The upper didn't need much, it's just lined up. Got these little bitty brackets coming across like that. Now here, this was 1990, and now this is 12 of 90. All right, let me go back here. That was 4 of 90 and 12 of 90. For that few months there, we have this on the way. It's going and everything. That's not much time at all when you're straightening teeth like this. There it is, 9 of 90, and that's 12 of 90. Wait a minute, that's 4 of 90, and now it's 12 of 90. We've got into this intruding arch here, was down here. You can open anybody's bite. I don't care how old they are, how deep it is, anything with one of these intruding arches like this, and then we have a regular arches in there like a round arch. That's the way those teeth were. And then this is 4 of 90. There it is, 12 of 90. This is lined up here now, almost like it ought to be. You're still going to have a bring it, and then the teeth will move out in that case. And they will tell you can't do that, it doesn't work. That's a bunch of bull. you saw what we did on that man. Now there's 12 of 90. We have those teeth that move there, and this is moved, and the bone moves with the teeth. I don't care what they say. Now, there's the cephalometric picture, and the teeth are closed up right up there, and we will go ahead and open that up. Now, there is no room possible for this wisdom tooth here, and you can look at this one, and some people say, well, you can't raise that up. You can upright anything walking and breathing. It comes in. You could leave this tooth in there and still upright it. It would bury it back in there, back here. So we recommended removing the hopelessly impacted. So then take those teeth out, and we'll set that tooth up right there like that. And that's 3/16 of 90. The tooth is down like that. We put that little uprighting spring on here. This is after we don't even need the orthodontics on there to upright this tooth. We'll bring it up in there. They take this out. We'll put this tooth right back in that place. And there's the tooth. And this is 15 years, 8 months, and that's 3 of 91. And we'll see that tooth move. Watch it. Now, once there, when you get it like that, then you slide it up in here. Now, people would tell you can't do that. That'd be difficult to do. You can do that. And just look at it again here. Put it in place. Now, what we're trying to, with the American Orthodontic Society, trying to show people anywhere in the world what you can do with the teeth. And if you see it done, then you can learn how to do it. So here it is, 93 now. We've opened this bite. We've got it over bites, okay. And we're finishing up the lower arch. And we had to get these teeth out of the roof of this guy's mouth. You would think this is some totally different person, but it's not. This is the same guy right here. And it looks like that in 93. There's an upper retainer. You'll need to wear this for a few years and hold it and then sleep in it and keep it till the whole thing moves to a point where the pressure inside and outside is the same in here, and they'll gradually come out of it. So here is in 93. That's the upper, and that's the end of this case. And I thank you for watching, and I hope you'll learn something from this. Go study that terrible case that we've just shown in there, but this is all possible for people to do. And if you want to learn how, and you want somebody to show you and help you, go join the American Orthodontic Society. And we just charge you so much for courses. You don't have to pay $500,000 to go to school there. So anyway, this is it, and I thank you for watching. And I want to sign out and say, join our deal and subscribe to our program. We appreciate your watching. I'm going to close out.